Hi, I'm Helen Swire. Welcome to Rewards Roundtable on Health and Wellbeing.
I think at the moment the benefits that we do offer are fairly standard across the legal industry. So they work in terms of, obviously, with the Bupa cover, the permanent health insurance, so for long-term sickness. We do actually occasionally use occupational health. We've started to use a company called Blossoms to refer people. So it generally works, but my objectives, and certainly coming here, is to see what other organisations are doing in terms of extending health and wellbeing in the workplace, because it's a project that I'm just starting to work on. So that was my objective, really.
Bims?
I think because I'm working in a charity, it's a lot different from being in the private sector. There are challenges in what you can actually offer staff. And we've sort of gone out, we've got a real myriad of different staff, retail and office-based, and low paid and higher paid. But what we think that staff have been wanting is something that's much more holistic and looks after the family as well. You don't necessarily join a charity because of the rewards as such, in terms of monetary rewards, but they want to feel that we're looking after their mental health and also their family's health. So that's what we're specifically looking at in terms of giving value to them.
So we offer full cover for everybody from day one with Pru Health, and that is for partners and dependents as well. That's pretty standard. We're in the management consulting industry, so that would be pretty standard industry-wide. Our main objective with the healthcare is to make it as easy as possible and as clear as possible for employees to make a claim. They work very long hours, it's quite a stressful role. Obviously, if they're then having to make a claim as something else on top of that, we don't want to add to that stress. We want to make things as easy as possible. We do work with an occupational health specialist when we've got long-term sick issues, and we do some initiatives more generally around wellbeing, but I'm quite keen to hear what else we could be doing, really.
Well, we have the scheme as I mentioned, just for the senior executives. So it is limited, and we have much control by head office. So they're the ones that set what we can spend. So I feel limited as to what we can do locally, and I just wanted to get some information really from those around the table as to what they're doing in terms of their wellness and well-being, and see how I can then take that up to head office to make a case, really. So it's quite limited. We have we use RPS, an e-portal for our occupational health, but even then we need to go through head office to explain the reasons why we're doing that. So it tends to be quite close. So yeah, it'd be good to get some feedback around the table on that.
Great, okay. Well, perhaps we'll come back to you in a minute just to look more about the challenges you face and in getting that past the FDs and up to head office. So Jerome?
I think similarly to most not-for-profits, healthcare isn't, private medical insurance isn't a big benefit. I think it's less than 10% of not-for-profits that offer it as a benefit. So we focus on the wellbeing initiatives. So we have an on-site cafe that offers a healthy 2-course lunch for everyone every day. We have employee support helplines. We have regularly organised wellbeing days where we get local suppliers to come in, talk to the staff, show the benefits. We have the local subsidised gym memberships, that general encouragement of staff to live the healthy lifestyle. And then on the same side, for the managers then to help measure short-term absences and how to deal with them. So focus on training and the return to work messages. This leads us to having a lower overall sickness absence than generally in the market.